Thanks, Michelle. How cool is it that you guys get to start the summit with us? I feel honored that we are your opening panel. So I'll take a few minutes today just to talk about technology adoption and building trust. All right. So pre-pandemic, adoption of technology was really optional. And it was really a matter of preference and convenience. So some people were using the QR codes, some people were using paper. You really had an option at the pace at which you adopted technology and if you did at all. And then lockdown came and it really forced adoption just for us to be able to have the basic services. And so one of the disruptions that I want to tell you guys about, an example, is the meeting experience and how that meeting experience changed. And so those that were used to coming into conference rooms, seeing everyone face to face, that changed with our new normal. I mean, how many times did you hear that during the pandemic? But we had to rapidly implement virtual platforms for the conference room experience. So my team originally had a 6-month project plan to implement Microsoft Teams, and then the pandemic came and we had to stand up this platform in 9 days. And so just the change there and the disruption to the meeting experience and how people trusted the platform or didn't was an incredible experience for my team. Also, a disruption during the pandemic was psychiatric care or all care. This was a big disruption to move from face-to-face care to screen life and virtual care. And it required trust on both sides, from the clinician that they trusted themselves to deliver quality care through these virtual platforms, and the patients to be able to trust that they could be vulnerable and that they could receive this care virtually, And so a little bit about my experience with building trust with new technology, not just telehealth, but other technology. My specialty and background is in electronic health records. So I came from Cerner before coming to the Menninger Clinic. And with innovation, with implementing new technology, it's critical that the IT leaders build trust with the administration and the staff that are going to be using the technology. And I think the most critical component of building trust is communication. Clear, concise, inclusive communication, being real and honest about what we're implementing, what the ramifications are going to be, what it's going to feel like to the users, allows us to build trust. So I'll give you guys an example of just differences that I've had in technology adoption from the nation of Qatar versus my US experience. So I moved to Qatar for 3 years, and my team, we had a small team that landed, and we were tasked with digitizing the entire nation for their healthcare documentation. So we had 8 hospitals, 23 clinics, they were all on paper. And so when my team landed and we had this huge task in front of us to get them off of paper in 3 years, our first most important effort was around establishing relationships, learning the culture, connecting with the people. And we felt that that was important before looking at the products, before looking at the project plans. We knew that we had to come learn these people. We did rounding at the hospitals and the clinics. We went to dinners with the administration just to really establish trust and relationships. And then we were ready to launch the project. We were ready to say, okay, we had a shared ambition and shared trust for one another that was so important for us to be able to do this, massive rollout. And we did it. It was successful. The adoption was high, trust was high. Doesn't mean that there wasn't fear, doesn't mean that the projects didn't have bumps in the road, but the resistance was very low. And I remember that and being surprised by that, pleasantly surprised. And then the other experience, coming back to the US, working with Cerner, implementing EHRs at all of these different health systems across the US, what I remember is that the implementations were fast and they were impersonal. So we would fly in for 6 months. We would do a quick project plan. Okay, we came very task driven. So we didn't spend a lot of time on building relationships, building trust. The clock was ticking. We would come in, we would implement the EHR. And I think the way that we underestimated that relationship building really hurt us. It made for very painful implementations of the EHRs. It made for just lots of room for resistance, because not only did the users not trust the technology, but maybe they didn't trust that this new workflow was more efficient. And so I just thought it was interesting how different it was for me to do the same exact work in Qatar and then also in these US hospitals, but the biggest difference being how we did not spend time creating these relationships. So after that experience, all of the projects that I begin in technology, I always think about, where do my key stakeholders fall on the technology adoption lifecycle? So when I'm starting a project, I think, do we have lots of people that fall in the early adopter innovator category, or do I have some like late adopter laggards, those that have high mistrust for technology? And that really drives the pace of the project. It drives how I equip my teams with the project plan and the tools. So if I'm dealing with stakeholders that really fall in that early adopter innovator, we can do a rapid implementation. As long as we're concise, we get on the same page with what the technology is. I notice that they have high trust and we can move quickly. If you have those that are on the other side of the spectrum, you have to spend a lot of time with change management, communication, thorough training to ensure that everyone feels comfortable and that the adoption is going to be solid. So it's a big consideration that I think about with new projects. So now my current passion is around innovation and how do we enhance the patient experience through technology. So here at Menninger, that's how do we improve the psychiatric care and their experience while they're here receiving mental health services, and how do I close the mistrust gap between the technology and our clinicians, which is critical before even building that trust with the patients. My team has to work to gain the trust of the clinicians, the staff that are going to be interacting with the patients with this technology. And so I think the most important thing is just high touch communication, being honest about, this is a pilot. Not everything's going to go, swimmingly. Please be patient, and just making sure that there's a high touch communication with new innovation, so that the clinicians don't think, hey, here's this technology leader just trying this new cool thing. No, we really want to bring in evidence-based value with this technology to the care. So I'm excited to share a few ideas, and I'll end with this, is just what we're currently doing and what we're looking at for digital tools in the inpatient psychiatric setting. And I know how important it is for adoption and for openness to try these new things with the patients is going to be, have we tested these things? And, making sure that all of the clinicians are trained and know how to use this technology. So if you look here, we have virtual reality experiences. So whether it's the VR headset or an immersive room, how can that be used with the psychiatric care? Also in the evenings or leisure time during inpatient psychiatric settings, how can the patients work out or use these digital exercise tools? If you see the workout mirror, we just installed our first one here, allows them to just de-escalate or be able to, if they can't get to the gym and if they're unit restricted, but they still need to get active, this is a great tool. We've also been thinking about how can patients, if they don't want to talk about certain things, and if they want to journal, prefer journaling their experience, how can they do that on this tablet and have that handwriting converted to text and sent to the clinical teams is a new digital tool that we're looking at. And then a few other things, just music, massage chairs, sound and light therapy. So we're looking at the problems that patients and clinicians are having across the inpatient psychiatric care, and how can we improve that experience with technology. But it definitely takes trust and communication for them to adopt those new tools, but exciting to be looking at them. Thanks, Michelle.
Awesome. Thanks, Lacey. So what is one of, like, on the ground floor, like when you're implementing new technologies like the mirror, what are one of like the biggest factors of mistrust, would you say?
It has to be safety. It's going to be safety. So physical safety, emotional safety, with these new products, is there any way for self-harm? Is there any way that someone could get hurt or hurt themselves? And then also the emotional safety, like, is this distracting from their treatment, or does it augment or supplement their treatment? So I think that safety piece is the biggest factor when especially in psychiatric settings, when we're considering new technology.
Yeah, that's a super good point. And is it clinically contraindicated, right, to use the technology or even be around the technology, right? Does somebody have, symptoms associated with paranoia, with, governments watching me, all sorts of things, that interaction with psychiatric symptoms, especially you're implementing technology on the full spectrum of care, outpatient and inpatient. And right, so especially in that inpatient setting, that safety and interaction with psychiatric symptoms is so important.
Yeah, absolutely.
And so how do you, kind of building off of that, what tools, I guess, do you use? You talked a lot about, when things are impersonal, it can go not as well. So how do you really use your communication to build that trust and create that personal relationship, particularly on inpatient settings?
It's a good question. So I'll give the example of the mirror. So one of the things when we installed that new mirror, patients had a lot of excitement around it, but also, what is this new thing? And so communication and training was really critical in ensuring that the staff felt comfortable with navigating the workout app, and also that they felt comfortable turning it on, getting a workout started. And the patients, we have community meetings where I was able to go and interact with the patients and say, hey, how do you feel about trying this out? I know that, you were thinking about going to the gym yesterday. What about this workout mirror? And just getting their thoughts on it and being open and available for them to ask questions really helps with the trust with the new technology.
Yeah, that's great. So really going to like the ground floor, going to you yourself as our IT leader for the hospital, really going to the ground floor and talking yourself directly with the patient, so you
Absolutely.
understand and build that trust. Yeah.
Yep.
Yeah, that's just phenomenal. That's awesome. Cool.
Thank
Thank you,
you.
Lacey.